This video will demonstrate the protocol for socket grafting without flap reflection using Augma Bone Graft Cement. With socket grafting we have two protocols. One is without flap reflection, and the other one is with flap reflection. The indication to use the protocol without flap reflection is when we have 4 bony walls. Watch the following steps from site preparation to closure. Site preparation. After extraction, we make sure that we perform a complete debridement, including the removal of granulation tissue. Cement activation. When the site is ready, we can activate the Bond Apatite syringe. We push the shaft slowly until all the liquid from this compartment moves to the powder compartment. Then we continue to push until the first piston reaches the line. Now the material is ready for grafting. Grafting. By a twisting and pulling motion, we remove the cap and then we approach to the socket and start ejecting the material into the socket at a 45-degree angle. As you can see here, we always want to slightly overfill. We take a dry, unfolded gauze and press strongly with our finger for 3 seconds. Place the periosteal elevator on top of the gauze and add compaction on the material for additional 3 seconds. Please note it is very important the material will be well compacted at the cervical area, otherwise patients may feel discomfort after a few days. It is not required to push the material down to the apex zone. We lift the gauze and remove excess. We can add a little bit more if needed. We press again using the same method, first with the finger, and then with the periosteal elevator. We remove excess from the side. Now, we need to protect the exposed graft using Augma Shield to allow soft tissue proliferation to take place. If we do not protect the exposed graft, it will wash out during the healing phase. Coverage. We cover the graft using Augma Shield. Augma Shield is not a membrane. It is an external coverage which enables soft tissue to proliferate directly above the graft, and it should be well secured until soft tissue closes. Nothing should be in between the graft and the soft tissue, and it is placed on top of the graft. This is the Augma Shield. As you can see, it has a matte layer here and a transparent one. The matte layer is actually the Augma Shield. The first thing that we do is to cut it and trim it to size. Now it fits the defect. We take a moist gauze and gently moisten the gum. In that way the Augma Shield adheres much better. Then we detach the Augma Shield from its under layer and place it on top of the exposed graft. Make sure that the Augma Shield will cover the entire exposed area and will be at least 3 to 4 mm beyond the exposed area from both the buccal and the palatal aspect. Now that the Augma Shield is in place, you can move forward to suturing. Closure. Augma Shield must be secured with simple cross-mattress sutures for a period of 12 to 14 days. If we do not secure the Augma Shield, it will fall off after several hours. We start from the buccal aspect by suturing from the mesial part to the distal. We continue to the palatal aspect from the mesial through the distal in order to create a cross-suturing on top. Now we create our first knot. We do not cut this part, because we continue to suture. We proceed vertically by going through the Augma Shield in that area. Then we go to the palatal aspect in the same way. Now we go to the buccal aspect. From the mesial through the distal horizontally. We proceed to the palatal aspect again. From the mesial through the distal. Now we make our knots. We will suture as much as needed to keep the Augma Shield in place. In that way we can be sure the Augma Shield will not fall out. We can take the sutures down after about 12 to 14 days, or we can use sutures that are resorbable with the exception of fast resorbable sutures such as chromic gut. Advise the patient not to do mouth rinses with salt water, otherwise the Augma Shield will shrink. To summarize, here are the key points for the socket grafting without flap reflection protocol. Site preparation. After extraction, make a complete debridement. Cement activation. Push the shaft slowly until the first piston reaches the line. Grafting. Place the Augma bone graft cement in the site, make sure you slightly overfill, then compact with a dry gauze for 3 seconds and add additional compaction with a periosteal elevator. It is not important if the material does not reach into the apex zone, however, it is important the material will be well compacted at the cervical level. Coverage and closure. The exposed graft should be protected using Augma Shield for a period of 12 to 14 days. Secure Augma Shield with cross-mattress sutures as required. Do not use fast resorbable sutures and do not advise the patient to use salt water for mouth rinses. You can send any clinical question to info@augmabio.com and we promise to answer shortly. Thank you for watching.